All right, let's get the recording going. Or a hospital when it has to do marketing in a new market or establish a new market. There's always this feeling that do they need a facilitator? What is the role of a facilitator and how important it is, and what is a value addition a facilitator can do? I want you to enlighten the audience and us on this particular factor, please. Over to you, Dr. Prem.
Thank you. So I always explain with one point. I think so. Let me turn on the microphone from here, and I will turn it off from here. Let's see if that works. Give me a second.
Sure, not a problem.
Can you hear me now?
Yes, we can hear you clearly. Is the audience,
Can you hear me
audience
now?
able to hear? Would you just like to raise your hands to tell us if you can hear us?
Yeah.
Perfect.
Yeah.
Thank you for that.
So perfect. Now, whenever I explain about the role of medical tourism facilitator or medical tourism business, the first thing I always ask them to think about, in an unfortunate situation, if you have to take your mother to abroad for the medical treatment, for example. And why I take example of a mother, because we know how much we love her, right? And how much comfort we want to give her. Now, when you go abroad, how many things you need? Obviously, you need a quality of healthcare services. You're going for surgery, so you need to have a doctors and team of the surgeon. But not only that, when you're going, you need a travel arrangement. You need someone to arrange for the visa. You need someone to pick up from the airport. Then someone to help you with the currency. For example, if you're coming from Africa, you have a local currency. Someone can help you with the currency. What if you speak that wonderful African language, but the doctors there doesn't speak the language? What if something goes wrong there? What if doctors started over prescribing medicines? What if doctor started over prescribing diagnostic and all? So who is there to provide comprehensive support services? And I always say that hospitals are traditionally always in a shortage of the resources and staff. No matter what department you go in a hospital, be it their medical department or marketing department, they're always short of staff. In such scenario, it is really, really difficult to even imagine or even to think that hospital will be able to provide comprehensive support services. So this brings a role of a support service organization. I always believe that the success of medical tourism can never happen without comprehensive support services. Now that support services needs to be provided either A, by the international patient department, which can take care of everything, or be a good qualified facilitator. Without these two systems, the medical tourism industry will not grow, because the complexities are way too many things. And the not only complexity, but area of expertise and area of knowledge required is way too much for one particular organization, hospital, as an example, is way too much for them. And for success of medical tourism, we need to make sure that that support system is there, and this support system provides the proper care. Right?
Absolutely. I think that's a very critical element that you mentioned about the support system, which is extremely required, and the element that could be either an international department. As you rightly said, hospitals always face challenges with lack of resources, and also they are probably too tied up with getting into the operational aspect of a patient care within the hospital. So you clearly defined it for us, and I'm sure the audience would identify people who are working in the hospital or people who are working as facilitators would identify with the complete scenario that you mentioned. And let's move to Dr. Afzal, and I would like to discuss with you, Dr. Afzal, whenever a patient is traveling, in relation to when we are talking about, we're talking with the audience in Nigeria, how can we take care of the cultural differences that is there between one country to another, and what is the importance of it, how important it is for a host country or a host team, a hospital or a facilitator, to understand the cultural differences between both different nationalities. Out of your wealth of decades of experience, maybe you could give us some anecdotes on the situations that you would have come across which made an impact on the patient care itself.
Thank you, Vidya, for this opportunity. And thanks, Usman, and organizer of Amwe, to calling me for this event. So that one is a good question. There are cultural barriers with the language barrier between the two countries. First, traveling from one destination to another destination, or as example from Nigeria to India or UAE or any other places. So the patients basically first things he want are perfections. Perfections in the sense where they will stay, the doctors he's going to select or going to treat them should be a perfect, qualified. Uh, Perfection in the sense where accommodation will be, it's a perfect. Perfection in the sense the transportation, each and every support services as Dr. Premjigyasi mentioned should be a perfect. So first thing perfect, but there is a question if he is traveling from one country, one culture to the another, how they mingle with them, how they merge them. So in this cases, basically when patient travel to India, suppose in any scenario when patient is travel to India, especially in Delhi or Mumbai. So we have developed a cultural support services like you easily find out the restaurant who provide the foreign cuisines, uh, very good manners. They try to create a aura or create a setup that is nearby to that culture. So if they are eating like patients who are traveling from Algeria, so there is a very good cuisine called couscous. So we find out, or patients who are Nigeria, they are non-vegetarian. Here they find they are traveling to India, so there should be they like the non-spicy things. So we find out the restaurants or guest house or accommodations that provide all these services that is nearby, not exactly, but should be a nearby. So if you say that the second things we find out, if you say that's three P's, we call this the three P's patients required when traveling from their own country to XYZ country for their health treatment. So first, the perfections, and the seconds that should be a price. So when they find out the recommendations, that should be under. So in these cases, we we have 3-4 category of the recommendations. If we go for the hospitals, then A category, B category, or the cost will be from one destination to other, or from one hospital to other according to the experience or experience, and of course about the hospitals infrastructure. So the second P should be prices, and the third should be as a culture thing. We find it, we call this a privacy. So patients all traveling to one place to another, they want their all the medical documents keep strictly under the HIPAA compliances. Nobody can talk about that. So it's a very personal thing. So in this cultural differences, we try to bring perfections, price, and privacy, all three parameters to platter to take the one patients who are traveling to another destination in a different culture, in a different scenarios. Over to you.
Yeah, that was very clearly mentioned about the three P's. I think the audience would really remember this very clearly, because for a patient, as you said, confidentiality, which is privacy, is extremely important. Perfection in terms of their transport or accommodation, everything else is very important. And little things matter a lot in terms of their cuisine, their food, and everything else put together. Even a language, somebody who speaks their language, everything matters a lot. So that would really impact in terms of a patient who travels, so that they can feel at home in a new place where they have come, and then focus on the critical medical care that is required for their family member. So that was very useful. Thank you for that, Dr. Afzal. Apart from the live audience who are sitting there, and the online digital audience who have joined us will hugely benefit from this. I would like to go to Miss Susan in the live audience to ask, from a Nigerian perspective, from a policy making perspective, from the ministry side, what are the challenges that you think that you're facing where the fraternity can help? I think coming together in this kind of a conferences is actually boils down into how can we bridge the gaps to identify the challenges where there are challenges, and also provide some solutions to that. So if I may request Ms. Susan to give us from Nigeria perspective, from our broader patient base, what are the challenges that you think the country would be facing, and what can we offer in terms of solutions? Over to you, Ms. Susan.
Okay, thank you very much. Again, I represent Ms. Susan Aboriare. My name is Biwari, representing National Association of Nigerian Travel Agencies. I've listened to the last two big speakers, make their contributions, and I'm here sitting and saying, okay, these are experiences for people with established domestic medical tourism. So I want to take you that these are lessons learned that we can apply when this really takes root in Nigeria. Having said that, we need to begin from the beginning. And I think the beginning is here today. And I went to thank the convener of this event today for this effort. In terms of policies, non-existent.
All right.
We are at ground zero. The reason I'm saying that is there is no standardized or established medical wellness as it's established. I can talk about religious tourism that exists. We know it exists. Medical tourism in the context we're sharing today does not yet exist. So this is one of that foundation has been which is getting all the stakeholders together.
Right.
Learning lessons from those countries who have established in this trade, and then begin to think of what we need to do. Now,
right.
I was talking to the convener yesterday and I asked him, how many Nigerian hospitals are here in this event? And he said, well, I sent invitations and they're not here. So imagine where, from the government point of view, government understands the potential of medical tourism, domestic medical tourism in Nigeria. So I think Dr. Frank or who spoke about exchange, possibilities of exchange. I'm in a conversation with a university in Switzerland to take up a program. But they're offering a program from the University of UK. So they have that exchange program. So from the policy point of view, governments will need to understand that there is potential domestic medical tourism. Why? Doctor, I listened to, sorry, I don't recall your name, talked about affordability in comparison to what will be paid when somebody goes outside to do this operation. A very close friend of mine had a hip replacement recently in one of the big hospitals in Abuja here. And I asked her, so why didn't you do it abroad? She said, it's expensive. I mean, if a Nigerian can choose that option, so it means that even Nigerians to start with will look at those options. But we need to get the first things right. Government needs to sit in this room to understand that there is gold in medical tourism in Nigeria because we have vision,
Mm.
We have the possibility of partnership with different countries across the world, those who have excelled in medical tourism. Conversations have to be held with stakeholders. And there is a need for standardization because I am not a medical tourism professional. In fact, after today, I'll begin to research. I have an aspect of wellness, which is my niche, but not the medical aspect of it. But as I sat listening to some of the presentations, I said, oh, well, this is something to look into. And I know that some of our members do medical tourism, but it's not standardized. So they are basically left on their own to deal with individual practitioners. And I mean, like, whatever risk comes, they're on their own. But the thing is, for this to work, there has to be that policy support. There has to be that understanding and buying from government to understand that there is potential for us to be able to grow medical tourism in Nigeria. When that happens, other things will follow, which I'll probably talk about in the rest of the contribution as we move along. Thank you very much.
Absolutely, yeah, completely. I know where you come from, and I think this is a great opportunity, as you said, since you're in a ground zero of creating the policies in terms of developing standardization, which is very critical because if people are left alone to do what they're doing, things can go in a different directions. And I think the purpose of this kind of meetings is taking forward, instead of just leaving it alone for this particular discussion, taking forward ahead. I would recommend the group together with Usman and everybody together to probably create a working committee for Nigeria in terms of then meet on a regular basis. I'm sure other members would be interested to be a part of it, to add value for it, Dr. Afzal, Dr. Prem, and to provide inputs in terms of supporting this cause of developing standardization, SOPs to be built, and how it can be developed. And another important factor that you brought in, Ms. Susan, is, I think pandemic taught us one big lesson is, there is no watertight containers in terms of different countries being branded as either outbound or inbound. Every country has a potential for both inbound as well as outbound patient care, and wellness is becoming so popular beyond elective medical care because people are realizing the importance of preventative care rather than wait until to find a disease and then go for a treatment. So that's a huge industry on its own. So this becomes a great opportunity actually for us to go forward in terms of establishing standardization. And the whole topic for this entire conference is actually sustainability for Nigerian medical tourism industry. So let's put the foundation stone in terms of developing this aspect to make this country develop this important sector worldwide. Across the countries, if you look at it, medical tourism industry is adding an important margin in terms of countries' GDP itself. And lots of countries are recognizing the need for it to make it formalized, give that industry a formal outfit. And I think we all have this great opportunity to work with Nigeria for this purpose. So with this thought in mind, taking forward, I would like to go to Dr. Prem right now. Dr. Prem, since we are going back to this ground zero situation where the country needs to establish standardization, what do you think are the key factors a patient makes a decision? What are the factors? Is it price? Is it a particular destination, a country fascination, or it's a popular doctor? What are the factors that makes a patient decide where they want to go for treatment, according to you?
I think so. The first and foremost is what is the key need of the patient now, and then what is not available or affordable in his home country. So now the patient, for example, when we talk about patient from Africa, of course, we are talking about sustainability and we are talking about patient should get the quality treatment in home country. But sometimes, despite of wonderful healthcare system that Nigeria has, sometimes the complex disorders or about the tertiary level care is not available there. So when patient realize that what kind of treatment which he needs and whether it is available or not, then he obviously is looking for the first priority become the quality of care for him. And then he started factor in everything, including what kind of travel arrangement he has, if he's selecting a destination, whether it is easy accessible for them or not. For example, for many African, getting to visa to Europe is not that easy, even though if they have a affordability and they have money and they wish to go to Europe immediately for knee replacement surgery, the process might take very long time. So one has to factor in all these things before we can decide about the destination. But in general, I guess I would say that destinations which are providing comprehensive support services, just not the quality services, Vidya, the support services in the sense, the destination who is able to provide the care part, then provide the quality part, reasonable prices part, then also all kind of small travel arrangement and support price. These are the destinations which are winning in medical tourism.
Right.
And it's the same for Nigeria as well. Let's say Nigeria wants to get patients from Saharan countries or some other places. Still, they have to do same thing. They have to look into providing support services to other African patients. You can never say one destination will thrive just by providing quality healthcare services. The quality healthcare services is just one dimension in medical tourism. You still have to work on many other dimensions to improve in medical tourism, isn't it?
Right, absolutely. Absolutely. I think that is a very important factor that you touched on in terms of comprehensive, which needs to check all the boxes that is required for a patient, because we could be best in one or two, but if the rest of other 8 elements are missing, then it cannot really cater to the patient needs. So absolutely right. I think that's a very, very important factor. I think these are the elements I'm sure the people in the audience are taking notes of it to make sure that we pass on this information to everybody who are keen to learn, to develop their own industry in terms of whatever they're doing. Could be a facilitator, could be coming from a hospital or from one of the government organizations. And I think we have Edwin with us. Edwin, would you like to switch on your camera? We would like to hear your views on this important topic and get you on board.
He's right here in the room.
Oh, okay, excellent, excellent. Could we get Edwin the microphone? Excellent. Welcome, Edwin. Good to have you as a panelist in this important group discussion. Coming from the hospitality industry, you being a lecturer and a fellow of the prestigious hospitality industry in Nigeria, I would like to take your views on what is the infrastructure availability in Nigeria with the capability to host inbound medical tourism. If you could give us a brief idea about this aspect about Nigeria, I think that will help the international audience as well in terms of understanding the capacity building options that's available within Nigeria. Over to you, Edwin.
Thank you very much. I'm very, very pleased to be part of this book-making event, the first of its kind. I want to start by that commendation. Down to your question or exposition, Nigeria ordinarily should not lack what it takes to be a key player in medical tourism. Because medical tourism is not like cultural tourism or ecotourism. For instance, you want to access Zuma Rock, you must come to Niger State to see Zuma Rock. You want to participate in Agu Fishing Festival, you must go to Agu. But medical tourism is an industry that can thrive anywhere, provided all the indices, all the factors are put together. If I have money today, I can go to my village and get the specialty outfit, do the infrastructure, do the promotion, do the coordination, and off we go. Then Nigeria has a big player in Africa. certainly has what it takes because we are not lacking in manpower, but we're lacking in infrastructure and government strong will. When you look at the population of the medical profession, they are not enough, but that does not mean you cannot take off because you keep improving on what you have. But the tourism aspect certainly cannot thrive without infrastructure. And the major challenge again is that there's this lack of awareness that medical tourism can still be can be intra and can be inbound. Once you talk of medical tourism, people think you must fly away. And what I want to talk of the inbound medical tourism are attacked and suppressed and cajoled and so many things. That's a very big factor that is not making it to thrive because some people are already benefiting from the business of the multi-billion business of medical tourism. And in one of my research for my master's in tourism, which was studio and medical tourism, the dimension between India and Nigeria, I discovered that some specialty clinics in Nigeria are doing so wonderful. Just like you said a little while ago, people are beginning to even understand that there are things you can treat here in Nigeria without necessarily crossing the border. But the awareness is not there, and infrastructure is not there, and government is not doing the needful because they seem not to. It seems there are more things added to this medical tourism, which we cannot finish everything here. Some people still hide under the medical treatment to do other things, which means even when they have it here, they will still have the urge, plus minus, to go abroad for other competing business. So I'm saying in my submission, that Nigeria has what it takes if we cross the T's and dot the I's. Because even in Europe, even in Asia, we have a lot of Nigerian born medical experts doing very well among the big teams that are getting success. So if we can have them there, that means we can have them here. The enable environment must be created. Remuneration must be there. Professionalism must come. Governments must do what they're supposed to do. So Nigeria to me will be a big player if everybody does what it's supposed to do. And it's a big industry that is yet untapped here. And it is effectively so much the money that's supposed to be here for other development so that social services, infrastructure, and social welfare will come up. So we can do that. Thank you.
Right. Yeah, that was really informative for us in terms of understanding the availability of the infrastructure and the hospitality situation in Nigeria. Because the trend is also the reverse medical tourism. It need not be patients traveling from one host country to a destination country. It can be actually about medical professionals traveling to another country, for example, to Nigeria, and setting up base there in terms of providing the care. Like there's a lot of big hospitals are setting up like dialysis units in different African countries, or surgical facilities in terms of even transplant facilities, or different kinds of facilities are being done right now in terms of collaborating by taking the medical team to the destination where the patient care is required. So at the moment, the focus is on take the medical team to the doorstep of the place where the consumers are there. With the world going towards everything moving to home delivery kind of a system, everything is getting into that phase right now. So keeping this in mind, I think we have a lot of opportunity for collaboration in terms of hospitality, transport, the hospitals and even clinics and every other caregivers that is possible to take this whole industry forward in terms of establishing a proper care. And taking this discussion forward to the next level of understanding how we could collaborate between India and Nigeria, I would like to go to Dr. Afzal and ask Dr. Afzal, with your experience in the past, Dr. Afzal, what do you think in terms of the Indian expertise? We have hospitals which are multi-speciality, doing thousands of cases. The success stories have been enormous. In terms of this kind of wealth of information available in clinical care in India, and also we are popularly known as the pharmacy of the world because we provide medicines to the entire world in terms of pharmaceutical industry as well. So what do you think are the key clinical factors that we could offer from India in terms of establishing care in Nigeria that could provide a base there in terms of care for the patients rather than expecting patients to come? Do you think something like this in terms of some important clinical departments that we could work to make it work? What would be your inputs on that, Dr. Afzal?
Excellent. Good questions, Vidya. Basically, the world is after the COVID, after the Corona, world is moving divorce. We have seen that earlier, all are doing efforts, spending time, money, energy to bring the patient from one country. Let me example to India and Nigeria. So bringing patients from Nigeria to India. But now
Correct.
the scenario has totally changed. Now we are taking care of few hospitals as a maintenance and operations as well. We are establishing the new departments, especially for the solid organ transplant, either liver or kidney or bone marrow transplant, which earlier it was either not possible or very risky for the source countries. But now we have recently established a few months back in Sudan as well as in Iraq, a solid organ transplant. So Sudan, we have done a 2 liver transplant, and with touch wood, both patients are safe side. But yeah, political scenario has changed, so we have stopped that. But apart from that, we have taken many hospitals in Uzbekistan, Nigeria. It's untouched now. Maybe if Nigerian government, as Mr. Admin clearly mentioned, that there is some less support from the government side. But when the scenario changed and we started to getting support from their side, from both the government side, then hospitals will go to them and start establishing or at least overcoming or taking care of the hospitals in terms of the marketing, management, and operations. So bringing the doctors. But the new trends are also coming into the light that good doctors from India traveling out abroad, going for a shorter time, doing the OPDs over there, and those procedures which is not too much complicated, or there are very less complications or less paramedics expertise required, they are doing over. But the problem is that if the hospital or the destination don't have a good paramedic supports, so there are most of the chances that the patient got infected for healthcare. So, but rightly said that now the scenario is changing. Doctors are moving and going abroad. Or the second things we have seen that the doctors from the one country, suppose Nigerian doctors want to come to India for a hand holding, for a support,
Training,
for a observership, or for training and fellowship. So we are welcoming the doctors in India for our hospitals, panel hospitals. Patient doctors are coming like Dr. Abdo, who is from Nigeria, who is the head of department. It's a neurosciences, who was in Vedanta and in Delhi. Spent 1 year, and now he is the head of the department over there. Too many other doctors are there. We have met a few Nigerian doctors during the Advantage Healthcare in Ahmedabad. this year, or in the beginning of the year in Delhi as well. So they are coming to India. They are seeing how we are performing, how we maintain the infections rate, minimize the infections rate. They are learning. Same for the paramedical staffs as well. We are also welcoming paramedical staffs. We are also seeing that's a few, there are a good collaboration between one company and the another company for knowledge exchange and the foreign patients exchange programs. So we tie up with the few Nigerian medical tourism companies. They are doing very well. And if you talk about the benefits, how they are getting benefits apart from doctors and the paramedicals or nursing staff, the facilitator or the medical tourism company also getting. You know, there are different time zone. Nigeria now it's around 1 or 2 p.m. Here in India it's around 6 p.m.
Correct.
Patients, when they talk about the 8 or 9 p.m. in their own country, that is a genuine times for them. But for India, we are sleeping. So we are collaborating. Okay, when such patients for such countries, their time zone are different, just collaborate with the those countries or those partners who are in the same region or time zone are the same. For collaboration, either it's healthcare prospects or medical tourism prospects, that's medical tourism partners are maintaining the very effective CRR, or you call customer relationship revival, or you call customer relationship management. So the facilitators who get in touch with the patient or the partner who get in touch with the patients, they are just working to revive the relationship with the different ways. So come to your questions. Yeah, we as a country, as a hospitals, welcoming for the Nigerian doctors, paramedical staffs, nursing staffs, support services to come to India and learn each other. So we know some things, they know some things, we can mutually learn from each other. Yeah, over to you.
Absolutely. Yeah, I think this is a way forward for collaboration. I think this is a benefit that worked out after the pandemic that happened was when there was travel restrictions. This is what changed. Hospitals started sending senior consultant to different destinations, started doing outpatients. And as you rightly said, you know, even solid organ transplant facilities being set up in different places. This kind of an innovation has happened. And I think knowledge sharing in terms of both the countries makes a very big critical factor in terms of, as you rightly gave some examples of doctors coming from there to India in terms of getting critical training and then becoming heads of departments in their own country, because that is a value addition in terms of both consultants for nurses and paramedics. That kind of a collaboration would work very well. So with this thought in mind, that as we are progressing in this discussion, I would like to go to Miss Susan, if it is okay, to discuss about, you know, the worldwide, the countries right now are realizing the value of providing a proper base for foreign direct investment. FDI is becoming really popular. Countries are recognizing the need for it. You know, there's no more restrictions right now. There's a lot of free zones being opened right now worldwide. I would like to understand, and I'm sure the panel and the whole audience would like to understand, what is the policy in Nigeria in terms of inviting foreign direct investors, like, for example, a clinic or a hospital would like to collaborate, or a facilitator would like to collaborate in terms of establishing an organization within Nigeria for collaboration. What are the policies available there and how friendly it is in terms of regulations? If you could give us an insight on that, please. I hope I'm asking a right person, because I'm not aware of the complete profile.
Because the convener was smiling as well. I know why he was smiling. So no.
Right.
The answer is no. So any such move, I think it's done on the private sector level. Any hospital, any health facility you have seen is collaborating with any international partners, doing that on their own accord, which is why I talked about, you know, the policy that is required to make this standardized. And also help Nigerians assess some of these relationships without people being exploited. So whether there's a policy, please, convener, you're going to educate me about that. What I sell is tourism products. If you're bringing medical tourism to us, our members are ready to take it to the markets, whether it's the African market or the Nigerian market. And before I forget, I needed to highlight this, and it's very important. I'm sure you guys have heard about Nigeria being the giant of Africa.
Mm.
But it's true. You know, that's the potential, that's the seed. I want everybody to take that away today. So imagine if Nigeria becomes that hub for the West African, countries. I'm not talking about South, because South Africa is there. This is Nigeria. With everything we have, the potentials that we've spoken about, the number, the facilities, he was mentioned about the hospitality industry. We have improved. In Abuja alone, please educate me, sir. How many hotels do we have? We have more than 200. Exactly. Thank you. You see, they are here. So we have quite a lot of those existing.
Right.
They are private sector driven. And they cost a lot of money, because there is a difference when there is government relationships. All right. Now, when a government is talking to another government, it makes it easy. It makes the private sector easy. I'll give you an experience, a bit of my experience in the travel sector. We were in South Africa early this year, but beyond that, this is what South African government does for its travel professionals. They have these industry, South African travel industry professionals, the Nigerian travel industry professional brokerage that happens. For any of those, even Turkey, those who are really talking about India, I'm aware of Turkey medical tourism. There is this brokerage that happens. So when there's a G2G relationship in an aspect, whether it's health, whether it's technology, whether it's whatever it is, it makes it a whole lot easier, because the standardization is created, the platform is created for practitioners to be able to establish partnerships that are beneficial to everybody concerned. So, clear answer to your question, there is no such policy I'm aware of. The governor is going to let us know. What I'm aware of is that private sector reach out to institutions that abroad they feel will fulfill their need for their patients, which is why the experience I gave earlier, a very close friend of mine had to have this surgery done in a hospital in Abuja. But there were consultants from outside Nigeria. So it's private partnership. So what I think this event is calling for is the general government-driven, government-backed step towards establishing and developing domestic medical tourism in Nigeria. Thank you.
Yeah.
So you want to tell us whether there is any such policy?
Yeah, if we could add more to it, that will be more useful. Yes, thank you.
Good morning, good afternoon, good evening.
Hello.
My learned colleague from all over the world. What I'm trying to say is an addendum to what my learned colleagues have just said.
Would you like to come to the front to capture yourself in the camera? If you'd like to come to the front,
Yes,
it'll help us to get better vision of your inputs. Thank you for that. Perfect. Thank you.
To be honest, there's nothing like that in Nigeria. Because it's just like a petty business we are trying to introduce in Nigeria. The main aim of this event is for us to educate, to enlighten, to change the mindset of our people, especially our medical personnel and those at the health affairs. Because majority of them, I cannot say they are ignorant of it, because medical tourism is a household name in Nigeria. But Nigerian understanding is about medical tourism is about outbound medical tourism only. They don't even know that there are other aspects of medical tourism like intrabound and inbound medical tourism. So, and I've been having this challenge and some of my colleagues in the industry all this while because many Nigerians don't have proper understanding of medical tourism. So they hate medical tourism with passion because many are ignorant of it. Whenever we are talking of medical tourism, they don't, especially our local healthcare service providers, they don't always give us this here. And the funniest thing is that some of them, they are seeing us as like a threat to their means of livelihood. I can remember one funny thing that happened recently. I went for one event and I was talking to a medical doctor managing a facility in Nigeria about medical tourism. He said, my friend, I don't want to hear anything about medical tourism. You don't want to hear anything about medical tourism because they are the one revising medical tourism in Nigeria. I said, young man, what do you mean by revising medical tourism? He said they are the only hospital in Nigeria that is revising medical tourism, and I said, so I wanted to give him my handbill. He collected my handbill and he wanted to bring it through it. Young man, can you give me my handbill? So many Nigerians are ignorant of medical tourism. They lack an understanding of medical tourism. Instead of to see what we are doing for them as a blessing, they see it the other way around. Thank you. I don't think there's any policy.
Thank you for pitching in.
Media, can I?
Please, please.
So I want to differ a bit. I mean, he's talking from a point of view of the medical practitioners. The professionals in tourism know that there is medical tourism. That's why we have partners in touch.
Correct. Absolutely.
So what we're asking for, because I remember asking him, why are the big hospitals in Abuja? I thought they should be here. I was explaining what he just explained. Now,
Correct.
I don't think it's a lost cause. I think it's about education. Now,
Yes.
you do not see a potential that hasn't been shown to you. Somebody may see a mustard seed and doesn't understand that it's going to grow into a big tree. You need to be able to put two things side by side and say, hey, this is possible. This is step 1, 2, 3 to do. And I want to go to the earlier recommendation you made, which is about creating a working group. That is a very good recommendation. They can come up with a framework to help achieve some of the challenges that are already existing with, first of all, a buy-in from government, a buy-in from the healthcare providers, and of course, creating a platform and standardization for travel professionals. Take these products, create more products from them, and begin to churn the money. Because I see gold, I see money at the end of the day, in addition to providing the healthcare service, because it's about business, isn't it? Thank you.
Absolutely, absolutely. Couldn't have agreed more. I can see the passion that you're coming from. And I think that makes a big difference. I think collaboration is the key factor among various elements. Different elements have to come together, collaborate, and take it forward in terms of raising the awareness, create more education, as you rightly said. And then this builds an opportunity instead of just looking at it as this is not available or that's not available or not being negative about the situation. Identifying the opportunities and moving forward is a key factor. And I think this discussion right now is popping into the next aspect about, I think we will come to the last segment of our discussion. I would like to conclude with one particular question to all the panelists that I would like to take your input on, is starting from Dr. Prem, is public-private partnership. I'm sure Dr. Afzal gave another set of P's in the beginning in terms of perfection and privacy and pricing and all that. But this is another set of P's that we would like to discuss right now, is PPP, is public-private partnership, because that's what is boiling down to everything that we are discussing among all of us right now in the last almost an hour now. is what do you think? What's your inputs on the PPP model that is critically required? Your few lines in terms of recommendation that we could offer to Nigeria in terms of developing the medical tourism industry for them. Over to you, Dr. Prem.
Yeah, so needless to say the how important it is to go into PPP model, and in fact we can add one more P, which is people. So public-private partnership with enhance, including people. You need all this from even for the infrastructure development and to the access to advanced technology which is happening. You need PPP model for even improving the cost effectiveness and quality and flexibility in so many areas which Africa at this moment require, which cannot happen, to be honestly, without PPP model. Why I say cannot happen without PPP model? Because the healthcare is traditionally resource consuming industry, and you need to understand that Africa is spending billions of dollars on healthcare right now. So if I talk with the current status of Africa is $35 billion which they are spending, and even if you add on $60 billion in healthcare in Africa, still they will not be able to reach to the quality which we see abroad. Also, if you talk about the pharmaceutical industry, 79% of medicines are still imported in Africa, right? So to overcome these challenges, I see only option is to go for more partnership models, be it a PPP model, be it more international joint venture models where more organization needs to pitch in to support Africa and more activities needs to, and forum like these needs to be created to enhance the value of each stakeholder for PPP model as well.
Yes, yes, absolutely. I think this is a very important model to move forward, to take it forward. I'd like to go to Dr. Afzal to take your inputs on this in terms of if you would like to add something more or your concepts or ideas that you'd like to bring in on this aspect.
Rightly said by Dr. Prem. I just want to one point I'd add, that one is the wellness. So wellness is a huge potential in African world. Patients, patients mostly travel from one destination to the another destination, which is the nearby, not too far. When first they try to find out the solution on those countries, within the country is not available, nearby the country. So they are starting to finding the solutions, wellness solutions for the partnership model, because it's a huge potential. In India, it's $8 billion US. And Kerala is doing very well. Kerala and some Delhi's organization is doing very, very well in terms of the wellness tourism. Apart from that, there should be a PPC model with the big giant, big corporate hospitals, and should be collaboration with the association who are basically taking care of the quality. So either it's a NABH, National Accreditation Board for Hospitals and Healthcare Providers, either it should be a Joint Commission International or different association like Turkish Healthcare Travel Council or Foundation of Healthcare and Wellness Promotional in India. So there are a different association are available who can give you either support as with the finance or with the knowledge. So that could be a best model. Over to you.
Absolutely. I think you rounded it off beautifully in terms of adding all the elements that's required. And I think accreditation is another important factor you touched base on, Dr. Afzal. I think that is where we could even, because since, as Susan rightly said in the beginning, there is so much opportunity to start the foundation of establishing all the policies. So that's where I think we could come in terms of offering them either any of these associations that are available across the world could help in terms of establishing this for the country. I think this has been a very meaningful conversation in terms of the panel. Susan, please go ahead. You'd like to say something, please.
I wanted to mention something, and I think it was mentioned yesterday. brain drain is not it's not new to everybody who has attended. The young lady who spoke about it, it happened just some of the things. Now imagine when this PPP model was established in trying to develop medical tourism in Nigeria. Things are happening. I was speaking with a young man who is a software engineer who works for a foreign firm. He lives in Lagos. He earns in dollars, right? So he doesn't have to go to that. He doesn't have to jack back. He's going to learn a new word today. We call, migration jack back. So he doesn't have to jack back. Be in Lagos, enjoy the Lagos urban life, and still work for this multinational company and end that.
Right.
So imagine when all these relationships are built, the doctors, because there's this established relationship with these foreign hospitals and the indigenous hospitals, and they can work and earn in dollars. They don't need to. There doesn't need to be brain drain. So
Correct.
that's the point I wanted to mention, so that we put this into perspective when we are talking about this at a bigger level. Thank you.
Absolutely. I think that is a very
Can I
important.
take a 30? Can I take a 30 seconds too?
Sure. Please go ahead, Doctor.
Basically, Mr. Usman Issa has tried to establish a association Nigerian healthcare. So maybe those who have a background of medical tourism join hands together or create something valuable, which will for you and for us as well at the discussion. Yeah, over to you.
Absolutely. I think, yeah, that is very important. I think we will give this opportunity for Mr. Usman to take it forward from here with the summary of the entire discussion that came up out of this important panel that we had today. I would like to really thank Dr. Prem, Dr. Afzal, and Ms. Susan and Mr. Edwin for this important discussion that we had. It has been enriching, and I'm sure it will lay foundation for way forward, and we look forward to see progress that is happening on the ground. And we stay committed to this cause. All of us are available here for future collaboration. And I would like to take this opportunity to thank Usman for this wonderful opportunity. It would have been wonderful if we were all being able to go there, but nonetheless, we are available there in our spirits. So it was wonderful having discussion, and we look forward to be in touch. And thank you everyone for patiently listening to us. And I'm sure we gave you some take-home messages and inputs in terms of raising awareness on this topic. Thank you, and over to the Master of Ceremonies at the event. Thank you for this opportunity. Thank you.
Just before we go, someone mentioned now, he says he has a question.
Question, yes.
Yes.
Abul Kalam, yes, please. Please, can you ask a question? The panel will be more than happy to answer. Please go ahead with your question.
Questions from the audience.
Yes, hi. Hello, everyone.
Hello.
Ma'am, I am a medical facilitator here in India, in Delhi.
Okay.
Actually, we deal most of the patients and we provide services from GCC, Gulf Cooperation Council. I'm not very aware about Nigerian patients. So I have a question. Could you provide information on the primary health issues that prompt patients from Nigeria to seek medical care in India?
All right. I think this would be an off-the-topic discussion that we are having right now.
This is a very specific question. Are there any specific medical services that patients often seek abroad due to their unavailability in Nigeria?
Yes, I'm sure there will be a list of services that they would be seeking. Maybe Usman can give us an answer for this if he is available there. Or Susan, would you like to take this question of what are the areas of interest for people from Nigeria who are seeking treatment abroad to India, specifically to Delhi?
Madam, please, can you repeat the question?
So maybe I can just jump in very quickly. Fortunately, we provide some of the audience are trying to understand what is the question about. So we have one of the facilitator in the audience in the panel who's asking the question that what kind of treatment Nigerian patients are seeking abroad. And because we deal with thousands of patients coming to us and we provide those patient lead generation across the globe. So it's mainly about the tertiary level complex surgeries, as well as the surgeries in the cardiology, neurology, oncology, and some of these areas. So we don't see much of the cosmetic or dental and all those areas, but the neurology, cardiology, orthopedic, and the oncology most important. These are the key segment where the patients are seeking medical treatment abroad. And whoever asked this question, I would also like to request him to start looking in the capabilities of Nigeria and see if you can start providing at least some patient from other African countries to Nigeria also, because the panel here is trying to create a sustainable strategy and not just a outbound marketing from Nigeria.
Absolutely. Yeah, that's the key factor. That's the intention of this discussion, actually.
Thank you for the question. Lovely question. Most of our the common cases we do come across day in, day out is oncology cases, cancer cases. It's very, very common in Nigeria. After cancer cases is very, very, very rampant, followed by orthopedic cases. And oncology, kidney cases also common in Nigeria. But there are some cases we can handle in Nigeria perfectly, like anything that has to do with IVF. With Nigeria, I don't think Nigeria has referred any patient that has cases of IVF abroad. So mostly cancer cases, orthopedic, urology, cardiology also, yeah, cardiology. Yeah, these are what the common cases. Common cases we see on a regular basis is oncology.
Oh, okay. IVF, neurology, oncology.
We also have questions from the audience. Mr. Solomon, please.
Sure.
My name is actually Mr. Christian.
Mr.
I think the question from his question was not fully looked at. He's talking about, if I understand, sustainability of your.
Sorry, I was trying to get him on shot. So
that's fine. Please go ahead. We can see you and hear you. Go ahead.
He was actually talking about, you answered one part of what you said. The second part, which is very vital, is sustainability of medical. Yes, we all move patients to India and all, but it's not just about business, it's not about service. And if it's not all about business, moving money to India, he meant sustainability of it such that we can intra-Africa in the continent.
Yes, within the continent, yeah.
What efforts are we making to ensure that it actually done?
Absolutely. I think that was one of the points Dr. Afzal mentioned as well. Yeah.
The effort that I'm making so far, yesterday, the chief of the representative of federal government, I mean the
Ministry of Health
was available yesterday and took a message back to his ministry, because there is no way we can talk of sustainability without first of all, without policy, without the natural environment, and without collaboration with those that are in the business for years. So for us to talk about sustainability without partnership with the expertise in the field. Some of you have been into this industry for more than 30 years, 20-something years, and your wealth of experience, because there's no way, because it's a very business, like as I said, so far. So you guys need to step in for us to be able to develop the sustainable treatment across Nigeria. Okay, so my question actually comes to the basic local one has actually been answered. There's no SOP in Nigeria. There's no organization in Nigeria. I asked that question actually earlier.
Now, internationally, I want to ask because, okay, sorry, my name is Chris. I'm actually an emergency ambulance service provider in our national ambulance service network.
Okay.
Consistently do have cases where, because there are no organized sector, like they say, you have to do referrals. There is, we have to actually facilitate medical tourism. We've had a very bad case wherein you actually, I don't call the name of the hospital, it's in India. We did the facilitation. There was a case, a problem in the we lost the patient. And this is actually what I know that we can actually handle in Nigeria very well here. It was out of what I say, I think they define negligence and whatever, you know. Now the patient relative could not in any way, they don't know what to do. There's no way to actually criminalize or actually check on what actually happened in that place. You understand? It's in far away India. They barely raise the money to actually move the person abroad, not about full cases. So what they have to do is to move back the cost. So my question is, do you have an international SOP? Do you have an international organizational group? I will take care of this type of thing that actually happens, whereby you make referrals and then the person, whatever happens to the person, happens to the person. That's number one. Number two, from an ambulance service perspective, we do ground and air ambulance service. We have, I don't know if this is possible. We have cases where, on a practical perspective, also, we flew a patient out of the country. The issue is a very complex case, you know. It was, you know, anatropic dependent, was on a ventilator, and was intubated. You know, so a specialist was on board. The issue of transfer of patients when you get the tarmac, as when you get to Thursday or wherever, and to transfer from the hospital ambulance, from the air ambulance to the hospital ambulance. You also have to transfer personnel. You understand? It would have actually been better and easier if that consultant who is with the patient all through can be with the patient en route to the final destination for transfer. Now, my question is that a way that international, if you don't have a group, you can actually help in assessing, making the logistics easier? Do you understand? I don't know if it actually would involve visa, because for a doctor that comes into India or any country, and you can only stay in town, you can't actually get out of there. I don't know if you get my question. Is that a way that you guys would actually ensure to make it a more smoother process, interpatient transfer in emergency cases, not just normal cases, people on critical emergency? Those are the two questions I asked. Moderator, I hope did you get my question? I don't know how the
Miss Vidya.
Miss Vida, did you get my question?
Hi. Actually,
Finally, you actually learned something from the Susan today. Japa. You know the meaning of Japa?
right. Thank you. Thank you for that. I think the accreditation programs can bring in terms of bringing international collaboration for bringing, the question that you asked about the policies, international policies, which can be brought in for the facilitators. The accreditation programs itself will bring in that kind of a quality system that is required. And I hope I understood clearly in terms of the question, because some parts were not clear to me. I completely understand the requirement of collaboration between countries in terms of the visa processes, in terms of critical situations where there is an urgency of a travel is required in terms of the whole visa processes. I think this is another foreign affairs relationship between, the countries that matters a lot. And that's one of the factors helps patient in making a decision on where they have to go. These are the elements. That is where an association will come into the picture, where an association can really support and make sure that these challenges are taken care. These elements are being streamlined in terms of having a smooth transition of patient care in any kind of requirement. And in terms of the sustainability we are talking about, to ensure that the industry within Nigeria in Ajuba is looking after is itself another effort that I think we all would collaborate to make it forward, to take it forward ahead. If anybody else in the panel would like to offer an answer, I would welcome you to answer for Chris. And then with this, we would come to the end to conclude. Anybody else would like to take in?
Recently, last year, Quality Council of India under the Ministry of Health, under the banner of National NABH, they started to accreditations and training program for the facilitator and interpreters. So they have established set parameters and guidelines for the medical facilitators. Apart from that, for the translator, there are some association in USA. They are also recognizing or training for the medical translator or facilitator in terms of the technology also. So on. Yeah, over to you.
Thank you very much, Ms. Vidya. Thank you very much, Mr. Afzal. Dr. Prem has gone off the grid, but this has been a very insightful session indeed. We've learned a lot, and we've taken notes, and we definitely will come up as the president, the vice president of the National Association of Nigerian Travel Agencies said here, that there was need to come up with a framework of some sort that should be presented to the government, the policymakers, so that we're able to come on the same page, tourism professionals and the medical practitioners. And we're also gaining from what Mr. Afzal has just said. He mentioned the critical role of associations, especially with regards to the role of the medical facilitators and the individual bodies that would help in the long run to ensure there is a smooth relationship within the sector. Welcome back, Ms. Vidya. I'm trying to do...
Sorry about that. I just got completely thrown out of the meeting room.
I was trying to recap, and one major factor that was raised in all of this is the subject of support system. If I were to ask a question, I would like to ask, can you break down the concept of support system? We just heard support system, but if you would break it down, some of the things I noted, you talked about the culture support service, the cuisine, the food, the proximity to the hospital. But could you just break it down? A support system, how do we create it? Thank you.
Sure. I think it's the training which is required constantly in terms of establishing a value-adding facilitator program, which requires, I think, a lot of our panelists themselves have been really doing this for many years in terms of establishing a process-driven, a patient-centered, with a customer, like how Dr. Afzal said, CRR, customer revival kind of program. All these elements are provided in terms of a regular, constant training. This is required in terms of collaborating for regular trainings to establish standardization, which could bring in the quality service that is required, and then collaborate with various countries where the patient exchange program is going to happen. And that is where all these elements would be taken care. So I think the key factor is collaborating with the right partners to take it forward would be the key element.
And establishing standardization.
Yes. Establishing standardization would come in terms of when we go for accreditation, the standards would gradually be implemented. This is a mandatory element in terms of implementing the standards, and that would bring in a lot of streamlining into the industry.
Can we just put our hands together for this brilliant session? Thank you very much, Ms. Vidya. Thank you very much, Mr. Afzal. And we also extend our gratitude to Dr. Prem. While the session was on, one of our guests came in, is Mr. Tom Paul. Please, shall we put our hands together for him? Just say hello to the audience.
Yeah, hi everyone. I'm Dr. Tom. I'm from Clinicals Global Hospital Group India. Sorry for the delay because of flight, but first of all, thanks to our team, Mr. Usman. The first event itself, lot of crowd, and I believe that each year will be multiplication of this. So thanks all for coming, and we look forward for a greater partnership. And as a hospital, we are being one of the largest healthcare firm in Asia, and we have been 34 hospitals in India, and I represent the group here. Thank you all, and look forward to everyone. Thank you.
Thank you very much. And so at this point, I'd like to invite Mr. Usman to the stage. You should have a final word because that's just about the last session for the day before we go for lunch. So let's welcome Mr. Usman, the convener of this event.
Good morning, good afternoon, good evening, my name is all over the world. I really appreciate your turn and I'm so glad and I'm so excited and before I need to say, just thank you very much.
Announcement, Mr. Usman, the year ahead, what do we look forward to for Amwe 2024?
Like I said earlier, the next Amwe, which is by God will going to be Church of August.
30th of August.
2024. It will not, but inshallah, it's not going to be on Zoom, it will be a live, and all my learned colleagues, from all the family will be on ground, and Nigeria government, I'm going to assure all of you that Nigeria government will be really involved. All these informations, all this share of knowledge ideas will be conveyed to Nigeria government. Thank you.